Hello and welcome to Visible Voices. The Visible Project is a Leeds-based initiative aimed at improving the outcomes of adults that have experienced any form of child sexual abuse. The Visible Project is made up of two equally important groups. The Strategic Steering Group, which consists of both statutory and voluntary organisations within Leeds, and the Visible Leadership Reference Group. This podcast is by Visible Leadership Reference Group that consists of people who have experienced any form of child sexual abuse, otherwise known as CSA survivors. Names may or may not be used throughout this series. In this episode, I will be speaking with another Visible member about our experiences of comorbidities. A comorbidity is when you have more than one illness, disease or condition at the same time. This is our discussion. We found a comorbidities definition on the government website, and we'll leave the link in the read-up of this podcast. So I'm just going to read out this chapter and maybe sort of break it down. There's 3 different examples, so I think we can sort of explore each one individually from our own perspective. And just to clarify before we continue, that every person that is a visible member within our group does have comorbidities, all of us, which we share quite openly with each other, and each one is slightly different, obviously, but there are a lot of cross-cutting themes that seem to thread through, the main one being sort of long-term PTSD and CPTSD, complex PTSD, post-traumatic stress disorder, but also linking the mental and the physical and the psychological aspects of our experiences and the impacts not only on our bodies psychologically or our mental health, but also our physical health impacts on our bodies. We've realised that there's a pattern there with all our members, that we have long-term physical and psychological impacts on our bodies from our child sexual abuse. So I will go into the first part. So comorbidities can be defined as, number 1, clinically dominant, where one illness trumps another, e.g. an index condition like dementia, which can overshadow the diagnosis or treatment of another like heart disease, known as diagnostic overshadowing. So that would probably be something, I suppose, more in your case, where you have a physical condition and then you've got the underlying CSA that can flare up and down or trigger. Am I right?
Absolutely. I mean, in my case, because I've got a severe brain injury and severe sight loss and thus have epilepsy as well, those sort of more apparent obvious physical elements and the resulting physical elements are the ones that are responded to and taken as feeding into the situation, rather than looking at the other deeper traumas that are within my life and are still part of what I bring with me and still part of how my body and my inner self responds to what's happening.
So when you go into a medical profession about your physical injuries and challenges, you are supported and diagnosed directly with those in mind, and the other aspects, for example the CSA and the other any other sort of impacts of the CSA, so the comorbidities of mental well-being and challenges that might have arisen from that are sort of separated or pushed to the wayside. And the consultants are focusing solely on your injuries as opposed to looking at your body holistically and your mind and sort of where potential impacts or troubles would occur. That's irrelevant to them.
Yeah, and I also think my personal experience is talking to the neurological consultant that I have, which is only about once a year if I'm lucky. Occasionally it's twice. And these days just virtual or over the phone.
How long is each appointment?
Usually about half an hour to 3/4 of an hour max.
Mm-hmm.
And I find that their way of sort of dealing with how those other traumas and severe traumas are is to say, oh, how's the family? How are things with your friends? You know, it's to kind of displace it and move on from that. And
As in an add-on at the end? Or
yeah, well, usually about the middle of the conversation. Okay. So it's kind of to divert from those historical long threads to the more immediate now via your family and how things and relations are with them, so they can come back to the surface, you know, physical presentations, in my case the epilepsy and the vertigo and the medication and all that, and come back around to that. But still feel they've acknowledged that there's a, you know, a wider environmental social thing. But that's it, you know, that's it, your family, your friends, okay, we've done that.
Okay, so the second type of comorbidity that is listed in this government document is synergistic. So that is related in how they arise and are treated, e.g. COPD and heart disease.
I suppose what strikes me is that there's not the mental health equivalent comparison in the statement you've just made.
No.
So what I'm saying is, if you've got, in my case, severe complex trauma, and you've got a few traumas in your life, and you've got PTSD and anxiety, it's not saying that actually the PTSD, epilepsy, etc. have a source and a link, and exploring that synergy or whatever else you want to call it. Do you see what I'm saying?
Yes. It's, yeah, you're expected to get used to that on your own and maybe refer yourself for treatment if it arises. Let's park it there, because I think number 3 is more important to us, and that's number 3 is coincidental. No obvious relationship and disease management is separate. Sometimes, yes. Well, in your situation, yes. But what we have noticed, particularly in members of every visible member has comorbidities. Quite a few of them are, now let me think of the word, autoimmune comorbidities later on in life from people who are CSA. I would love to see a research done into that. And I think we've said that we haven't been able to find it. We did do a search for this before, a few months back in one of our meetings, to see if there was anything to show that CSA survival and the connection of, you know, the correlation to how many people have autoimmune diseases after CSA compared to the wider population. And there isn't any statistics or examples. I think it's quite specific research. But it also says here, whilst further work is needed to characterise the burden of comorbidities, including which combinations carry particular high mortality, in brackets killer combinations, and identify effective interventions, we should expect costs to rise and the need for greater capacity across the health service to increase. Costs are usually higher for comorbidities, especially when physical illness occurs with mental illness.
Well, there you are. We're expensive, you see. That's
Yeah.
Causing a great problem.
Yeah.
We're too expensive.
And it is estimated that comorbidities cost £8 to £13 billion per year in England at present. Yes, you're right. We're worth it. And we are. But yeah, that just shows it monetarily exactly
how it's viewed, basically, and that, you know, that at the core of the responses that we get from the health service and social services is the economy and the economic aspect of it, and that's at the core of where things go.
Yeah, without getting too political or angry, I totally agree, but it really does kind of put a figure for me on exactly how much impact comorbidities in general, but in our situation specifically, CSA and additional ailments that either come out of the CSA or are coincidental, but it really shows how much of an impact it has on the self.
Well, also, I mean, it shows that if this was respected and the CSA within the comorbidity was respected properly, and they could utilise that to actually benefit both the physical and mental health, but also the cost, because there would be less long-term backwards and forwards and support needed, because it hasn't really been sourced properly and looked at in as part of a long-term lifestyle, which is with that individual. I think that's, again, an illustration of lack of communications, as we've said, between the different elements of the support or treatment that you're receiving. I think also it's a lack of time on the part of the recipients of yourself in whatever situation it might be. And quite often they're under stress and they're not able to look through all the flagged up records or whatever aspects. And whilst I sympathise with them as individuals, I think the system needs to be cleaned in the sense of clearing out and recognising that sometimes the time spent in ensuring that those sorts of elements are taken on board will save time in the longer term when recovery's there or rehab's there or people are pulling back through for whatever they've experienced. So I think so.
Tell me about some of the physical impacts that child sexual abuse has had on your body.
I think for me, it's been a learning curve. I think issues that I've had over time, I've not been aware that they've been related to what happened when I was little. I've had issues with my bladder. I've had issues with my immune system, my body not working right and things like that. I've had illnesses like anorexia nervosa, which also has a huge impact on the body. But it's not till having therapy that I worked out that all these issues were to do with what happened when I was little, which is the abuse. I just thought I'd got an eating disorder and just the medical problems associated with that. I was 4 stone when I was 20, so I had hypothermia, I had heart failure, kidney failure, renal failure, every vitamin deficiency going, and that kind of thing. And it was, that's just to do with an eating disorder, and that's what happens when you have an eating disorder. I've had issues with IBS, irritable bowel syndrome on my bowels, issues with my bladder, not being able to control my bladder, and those kind of things. And I just thought, that's just what I'm going through, or that's just what I'm experiencing. Like with my bladder, it wasn't till I'd been treated by the hospital had on different medications and different treatment programs for my bladder not working right. And it wasn't till I saw the surgeon and he actually said, this is very common in people who have been sexually abused as children. I see the impact of childhood sexual abuse as something which is not generic to people. It's completely different in every person. Although we have had a very similar experience, the analogy that I use is if we class childhood sexual abuse as boiling water, if you put an egg in it, it will go hard. If you put a potato in it, it will go soft. If you put coffee granules in it, it will change the liquid completely. So basically, we've all experienced the boiling water, but how we've responded to it and the impact that it has on us has been significantly different and is significantly different between individuals.
The following is a list of some of the effects of childhood sexual abuse.
Eating disorders, irritable bowel syndrome, post-traumatic stress syndrome, anxiety, attachment disorders, self-harm, obsessive-compulsive disorder, anger, guilt. heart disease, hypersensitivity, depression, alcohol misuse,
low educational attainment, homelessness, gynecological problems, reenactment behaviour, difficulty swallowing, sexual problems, hypertension, pregnancy, commitment issues, withdrawal, vulnerability, fearful, low self-esteem, nightmares, lower immune function, separation anxiety, development issues,
somatic complaints, flashbacks, trust issues, diabetes, hypervigilance, panic attacks, impulsiveness, inability to concentrate, dissociative amnesia, body image related problems,
internal damage, autoimmune disease, isolation, fibromyalgia, memory loss, numbness, denial, incontinence, lack of self-care, hair loss, feeling unsafe, infertility, borderline personality disorder, phobias, emotionless, criminality, promiscuity, obesity, stealing, overcompliance,
unemployment, pelvic pain, self-blame,
gastrological issues, re-victimisation, absconding,
inappropriate sexualized behavior, bedwetting, pain, passivity,
cultural or gender bias, codependency, normalising, lying, frozen development,
lack of empathy, cruel to animals, stroke, death, refusal to be touched, fear of raised voices or noises,
addiction, rocking, minimization, pressured speech,
anhedonia, helplessness, shame, cancer, heightened stress response, relationship difficulties, chronic fatigue syndrome, drug misuse, sleep issues, hopelessness, mood swings, dissociation, risky behaviour, repression, hoarding disorders, neurogenic destructure overactivity, headache.
I'm just going to read this last, we've got 5 minutes left, and I'm just going to read this last paragraph. Some lives may be saved in short term from improved management of comorbidities, but the system-wide action that is needed to address comorbidities will take longer to implement, and therefore the benefits in terms of population well-being will be seen over a longer period of time. Yeah.
Yeah, absolutely. Yeah. Yeah. In fact, that's what we've just been talking about in this conversation, isn't it? About how you get those communications, give that time, give that history. Yeah. Yeah, and it does unfortunately take a long time. But I think that we all know that the results of that is people who can manage in themselves, but also help relate with others and things in a lot better way.
Mm. Thank you to our members for that discussion, and thank you for listening. We'll be revisiting this topic again in future episodes. To close out, here's a few related stats we found.
Research has found that survivors of childhood sexual abuse are more prone to certain conditions. Here's what we've found. Risk of stroke, 7.7 times more likely. Heart attack, 5 times more likely. Irritable bowel syndrome, 4.7 times more likely. Chronic fatigue syndrome, twice as likely. Fibromyalgia, 65% more likely. Heart disease, 62% more likely. Cancer, 49% more likely. And finally, 57% of women and 41% of men who was sexually abused as a child have experienced domestic violence as an adult.
Sources will be in the show notes. Come back for our next episode when we will be discussing our members' experiences of accessing healthcare. Toodle pip. Thank you for listening to this episode. We hope you found Visible Voices interesting, thought-provoking and helpful. Visible Voices was created and delivered by the Visible Leadership Reference Group. Special thanks to all those that contributed today. Western Studios Leeds Limited for facilitating the podcast. The music was produced by Mark Parvin, aka Marvin Parks. To find out more about the Visible Project, go to visibleproject.org.uk. You can also follow us on Twitter and Facebook. If the content of this has affected you and you live in Leeds, please go to the child abuse subsection of the Mindwell website, mindwell-leeds.org.uk.